Hello, everyone. Welcome to our keynote panel for today. We're very, very excited to bring you in on what is, I think, one of the most important discussions of this week, and one of the really getting to the heart of what this show is all about. We're looking at the concept of what we're calling wellness for prevention, but really exploring the opportunity for FMCG, fast-moving consumer goods and services, as well as consumer health, to deliver population-wide health improvement. I've got a fantastic panel for you today, and I know that they're very, very passionate on this topic, so very, very excited to bring them into the discussion. So without further ado, I'd like to hand over to our moderator today, Judy Stenmark. Thank you, Judy.
Thanks, Angela. And I think it's really timely, this discussion, because let's face it, health and wellness are on the tip top of everyone's minds right now. So maybe we could go to the first slide, and I'll introduce the panel. Okay, next slide. So I'd like to introduce our esteemed panel. It's really high-profile group, bringing in lots of different ideas and coming from different spheres, if you like. So our first panelist is Samaras, who is Global VP, Science and Technology from Unilever. Then we have David Evendon-Challis, Chief Science Officer for Bayer Consumer Health. Filippo Lanzi, Head EMEA, GSK Consumer Health, and Tom Wallace, Senior VP, Advanced Innovation, lululemon. So welcome, everyone. And so I just wanted to start off with talking about self-care, because that's a major part of prevention and wellness, and also that's where I guess I'm coming from. So I'd just like to show WHO's working definition of self-care. So that's the ability of individuals, families, and communities to promote health, prevent disease, maintain health, and cope with illness and disability with or without the support of a healthcare provider. And one of the reasons I put that up there is because self-care and self-management of your health has very broad connotations for a lot of people. And we're always struggling this when we go to different audiences. And so we're actually working with WHO at the moment to look at that definition and see if perhaps it should be tweaked. But referring to holistic services and practices, using products, both medicinal and non-medicinal, devices, nutritionals, anything a person can do to improve their health and well-being, but also making healthy lifestyle choices, which is important, avoiding unhealthy lifestyle habits, making responsible use of prescription and especially non-prescription medications, and recognizing symptoms and self-monitoring. And of course, the ultimate goal is that people become active self-managers of their health and their ill health, if you like. So next slide, thanks. So we see the benefits of self-care and people being active self-managers as creating better choice of healthcare options and more accessible options for people, creating greater value. And we do a lot looking at what's the value we bring to the individual, the consumer, but also the patient as well, and how can we create better long-term health outcomes. And for systems, we're looking at how can we ease the burden on systems, and we believe self-care does that, and we're currently undergoing a lot of research to look at how we can really show the value of people engaging in self-care. And of course, increased freedom for innovation, always important in the healthcare market and the healthcare sphere. So next slide, thanks Angela. So I won't spend too much on this, but global knowledge transfer for better global health outcomes is something that we're really engaged with, and experience can be transferred through health systems, and different groups have different roles and they need to take responsibility in keeping consumers informed, and especially in terms of digital healthcare, telemedicine, increasingly relevant. And again, in this COVID world we live in, looking at literacy, healthcare literacy, and digital health literacy, more and more important, and that's just going to be a major thing, we think, in terms of consumer health and the world that we are in. And of course, individual access to healthcare professionals is increasingly limited and may remain so. So people need to seek information on their own, and we need to help them with that in terms of wellness and prevention. Next slide, thanks. So Now is the time for self-care, and COVID has really shone a spotlight on self-care and opportunities and responsibilities for consumer health and FMCG to really demonstrate our role in prevention and improving consumer health outcomes. And so there's been lots of opportunities and of course, lots of challenges as well. And I think we're going to discuss some of those in a moment. Next slide. Thanks, Angela. So the future of self-care has never been more important for individuals to take control. And I think we all have an increasing role to play, but really leading to better choice, better value, and improved health outcomes for all. So that's what we want to focus on today in terms of delivering population-wide health improvements. So next slide, Angela. Okay, that's the last slide. So I think what we'll do now is we're going to go to each of our panelists, and we're just going to ask them to give their perspective in terms of the area they're in and what they think of the big opportunities, challenges in terms of approaching preventive health. So I think I'll go to Sam first. So Sam, would you like to go ahead? And
Sure.
it's about
And
5 minutes each.
Okay. I can spend a little bit of time. The interesting thing about Unilever, obviously, we have such a diverse set of FMCG spaces. If you think about, we're really made up of 3 divisions of food and refreshment, of beauty and personal care, and of home care. And we have now an emerging segment also of VMS that we've entered into in the last year. And it's, really about 3 focus areas, one of which really deals with what we're talking about today. One is improving the health of the planet. Unilever has been for a very long time well known for our sustainability agenda. One is around improving people's health, confidence, and well-being. And the 2 places we're really focusing on is positive nutrition and health and well-being. And then the third is contributing in a more fair and socially inclusive way. But I'll focus in on the improving people's health, confidence, and well-being. And we think about it you can almost think about it as things you put on you, things you put around you, and things you put in you, right? If you think about our beauty and personal care products, things like skincare or hand washing, and obviously that has had a much larger prevalence in health and well-being in the last 18 months, but in many places in the world has a huge prevalence in driving health, for example, in children, and diarrheal disease in India, for example. So we've always been very heavy in hand washing, and it's just risen to a much more global prevalence in the last 18 months with COVID-19. Food and refreshment, really looking at positive nutrition and really helping people to transform the food chain to help people in that area. Our focus on plant-based nutrition. And if you look at, obviously, we're all at home now, much more than we were out of home eaters in the last 18 months, and innovations to help people make those better choices for themselves at home. I know for me, for example, you can't see right off my right or left shoulder here is the kitchen, which means I'm 4 steps from the kitchen as compared to where I was in the days before COVID. And so making those positive, healthy choices, I think, is a really big piece of delivering population-wide health. The health of your home. Most of us are privileged enough to be sitting. You can look around at the panelists, and the rooms that we're sitting in are healthy and are clean. But there are many places in the world where that is not the case. And the home environment and sanitation and even just basic things such as toileting and providing that sort of sanitation for folks in terms of health. And then the last one has really been emerging in the last 18 months. And for Unilever is the fast moving area of VMS and the brands that we've gotten to in that space, and really about making health and choosing healthful options a source of joy rather than a source of anxiety. And you can see that in some of the brands like Ollie and Smarty Pants that we now have entered into that market. And so it really is all 3 or 4 of those are about helping consumers actually in their everyday touch points. The amount of times a consumer touches a Unilever product a day is massive. If you go and open your cabinet and see all of your different products, we have such an opportunity to make little moves many times a day that will drive health and well-being, whether it's through confidence building, I can see Tom below me in the area of exercise, some of the products we sell, deodorants and skin cleansers, and that helping you to either recover from that or to make yourself presentable to go back into one of these things where everyone can see your face, as well as I said, with healthy food choices. So again, it's really broad based because we have such a broad base of different types of products, but it's to help people take control of their own decision making and offer up not only good things that are good for you, but things that you'd want to use, because of course, if they're good for you and they're terrible, no one's going to want to use them again. So that really is sort of how we think about this particular area and improving people's health, confidence, and well-being across the very large platforms of different things that we offer through the products and brands we have at Unilever.
Thanks, Sam. That's a really good overview. So Filippo, why don't we go to you next? You've got 5 minutes.
Thank you, Judy. So first of all, at GSK Consumer Healthcare, our ambition is really to empower people to manage their everyday health. So we want to do it in order to give them confidence and effectiveness by, in a way, providing a science-led, expert-recommended product. Our portfolio is spanning from toothpaste with Sensodyne to VMS with Centrum, and we reach out to about 2.5 billion of consumer across the region, across EMEA. So it was very interesting to hear from Sam because differently from Unilever, we are very much focused on self-care based on our current portfolio. And we believe that self-care is really critical to prevention. First of all, as you said, Judy, for the individuals, but also for the society, for the broader environment, and we are working to redefine self-care in order to fully realize the benefit that self-care can bring to both individual and to the entire healthcare ecosystem. Fundamentally, I would say that in order to achieve these, we have three sort of priorities, three elements we are looking at. The first one, which is very consistent with the introduction you have made, it's really about health literacy. So we fundamentally believe that there is a huge need and opportunity to educate people, to educate consumer about self-care in a very holistic point of view. So it means all about solution that people could choose to solve their problem, or understanding where to go for having a credible health advice, when to visit healthcare professional, etc. The second is more about prevention. We all know that when you take specifically Europe, only about 3% of the healthcare spent is about prevention. So we do believe that there is a huge potential for improvement in this area. And the third one is about healthcare professional, because we do believe they are really key enablers to deliver self-care and to provide accessible, expert, reliable solution as well to the consumer. Now, one thing is pretty clear to us is that given the challenges, the opportunities, given also the new world post-COVID, we can't accomplish this alone. So we believe a lot in the concept of partnership ecosystem, because this means across organization, but also in a way where public and private sector organization can work together in order to achieve the same collective goal, which we really believe it is really needed, because it is no longer a sort of siloed approach. So the partnership ecosystem, it's clearly a key success factor for the future, and to really exploit what the benefit that self-care can bring to both consumer and the environment.
Thanks, Filippo. Okay, I think we'll stay on consumer health and go to David, and then Tom will bring you in at the end. Thanks, David.
Thanks. So if you don't know Bayer, we work across most of the big self-care categories like allergy, cough, cold, pain, cardio, dermatology, digestive health, and BMS. I think prevention over treatment has been a big trend in health the last couple of years, and it's been massively accelerated by COVID-19. You know, the awareness of behaviors, lifestyle factors, the role of good nutrition, for example, you know, it's top of mind for many people now. We've seen categories like VMS jump massively in the last year. I'm really interested in the role of innovation in achieving better health. And if we take a step back, I think for me, it's not just about, you know, decent products and good marketing these days. It's about great products that really work, backed by credible evidence. And for me, it's also about ensuring that these are not just functional products. They need to be product experiences if you're in consumer health, co-created with the people that are going to use them. And it's where all of these converge, you have great innovation. You know, my favorite at the moment is we're just launching a dry skin range for our global derma brand, Panthen. We know that even though this is quite common, there's lots of products out there, we know that about 60% of people with dry skin aren't happy with their current products. So we designed a product that feels great to use, but also in our clinicals, we showed that it increased ceramides in the skin by 23%. And after a month, 64% of people you know, show increased hydration. So it's the blending of all of these things that are important to me. And I think beyond that, if you go up from the product to the individual, it's about this move to personalized healthcare. And there's a big difference for me between off-the-shelf, customized, and truly personalized health. And it's about really understanding, you know, for nutrition, what's your nutritional gap? What are the products, services that you need, and how this changes over time? It's not going to be a magic pill. It's about a combination of these interventions, as you were saying earlier on, Judy, particularly, you know, diet, exercise, lifestyle, that are together going to have this big impact. So some of the things that we're doing, you know, we made a majority investment in a company called Care/of, which is a great personalized nutrition company in the US, and that allows us as a company to get more experience faster of this kind of world. And, you know, it's super relevant across all of the self-care categories. And I guess if you just go one further notch up and look at populations, not just the individuals, you know, I think we've got some way to go as an industry. And our goal as Bayer is to provide 100 million people with access to everyday health by 2030. And part of that is going to come from innovation, some new innovation, some existing new formats and things like that, but it doesn't reach everyone. And so that comes back to the partnership piece to increase your reach, involving intervention, including things like donations, as well as education and advocacy, so health literacy and education. So one of the things that we're doing there is partnering with Vitamin Angels, you know, reaching millions of women and children around the world each year. And I think what's important for these kinds of things is it's not just a donation. It does cover each of these areas: intervention, education, and advocacy, because donation alone isn't going to give us that long-term success. We need to change the attitudes and the system, which is really what we're all about with our vision of health for all.
Thanks, David. Okay, so Tom, bringing in a bit of a different perspective now from kind of the exercise point of view. So we'd love to hear from you.
Thank you for having me, and hello everybody from a sunny Vancouver today. Yeah, the Lululemon perspective I'd love to share. I mean, has anyone noticed that when we start talking about health, how sort of serious we get so very quickly? Our view, and I think, you know, the perspective may be that to sort of bring a slightly different thought to this is, you know, the most important well-being practice is the one that you're actually going to do. And therefore, the elimination of any barriers to those well-being practices really is the mission that we have. And Lululemon, you know, we generally dress people. You know, we are a clothing retailer, but what we promote and the areas of research that we do is in understanding all aspects of well-being, so that, you know, business and product categories can expand. We recently acquired a fitness platform where we really wanted to bring a cultural lifestyle to within arm's reach of desire for all of our consumers, who we call our guests. Now, the reason why that's important is because we know, I mean, we didn't invent this, but we've dimensionalized well-being in such a way where if people can understand that they have the opportunity to affect their personal health physically, emotionally, mentally, and then socially, and either one of those can support either one of those. And the opportunity then is to say, well, if there's a set of cultural, you know, values that we can bring to an individual, and we can make access to choosing a wellbeing practice easy and fun, then people are most likely to do it. I mean, we conducted a really interesting report, a global wellbeing index report, just a few months ago. And what we discovered, disappointingly, was that only 29% of people across, you know, the different regions that we spoke to feel like they have a handle on their well-being. And, you know, there's, you know, worrying statistics associated with, you know, the younger generation, Gen Z, who are feeling the highest levels of anxiety here. And again, we start to look at health, and we start to even look at the questions that we ask, and we see how serious they get. And you think, take that tenet that, you know, if you fight for your limitations, then, well, you get to keep them. Well, maybe there are other ways. And so what we've been doing is analyzing. So I run the R&D department at Lululemon. We've been analyzing those different dimensions of, you know, physical, emotional, and social health, or fitness, as we often describe them, because we feel everyone has a fitness and everyone can choose to be fitter. And so the dimensionalization of those has given us access to creating new ways for people to choose to be healthy. Now, in those dimensions, what we're also seeing, and again, when we start to analyze the healthcare industry, we think that the biggest challenge really to overcome is human behavior. And again, we are not the first people to recognize or challenge that this is what needs to be addressed. But if you start to deconstruct some of the human behaviors that are going on, of course, we all go for the quick fix first. You know, we are interested in the pill, the lotion, the potion, you know, the wonder thing that's going to make all of our woes go away as quickly as possible. And then followed by that, then we'll probably, you know, subscribe to some kind of, you know, dimensionalized or structured program, a 30-day challenge, or, you know, something associated with either weight loss or a shift in our lifestyle, that the structure really helps us to achieve that. Now, the things that actually work seem to be, and it's very well reported, and I don't know why it doesn't get a bigger platform, but David, I think you mentioned it, you know, being physically active regularly doesn't mean you have to race Ironman like Sam's husband. Doesn't mean that you have to be, you know, at your physical limit every day, but being physically active, a healthy diet, which means a balanced diet, sleep like you mean it, and have wonderful relationships. So statistically, and not research done by us, but research that we consistently read over and over again, those 4 practices, those 4 well-being preventative practices can outperform all structured programming and all quick fixes put together. So why aren't we making that just a little bit easier? And easier isn't necessarily about too much education. We all know we shouldn't eat cake, but we still choose to eat cake. So, you know, I think that the knowledge gap is not as big as we make out. I think the behavior gap is a little bigger. So, you know, the question that we have, you know, to healthcare industry, and our desire to learn, is how can we encourage those behaviors? And maybe it is the redefinition of the health professional. Maybe the health professional is not a healthcare professional. It's not someone we go to when we are feeling unwell. It's someone who is a partner to us in our community that gives us access to these positive behaviors. And so our perspective is whatever we can do to put those positive behaviors within arm's reach is something that will have a massively positive, if not slow, given, you know, the competition against quick fixes, impact on total well-being.
Thanks, Tom. So I agree. Why don't we lighten the conversation a bit when we talk about health? I think that's a good point. But one thing I might just touch on, since you just went, something you said about the wellness practices. And I think we'd all agree, of course, that those points are critical and can outperform all other indices. But coming from a health and scientific background, behavior change in terms of things, those practices, is the hardest thing in the world to change. And every healthcare professional in the world knows they should eat better and exercise a bit more perhaps each week, and they don't. And nurses are the biggest smokers in a group in the world. So, no one really has the answer in terms of behavior change, apart from, you know, you've got to do something you like and you're more likely to stick with it. So bringing that in, what about digital health, bringing in the digital aspect right now in terms of behavior change? Have you got any thoughts on that?
Yeah, I mean, if you think about, again, the most important practice is the one that you're actually willing or able to do. A lot of it comes down to accessibility.
Mm-hmm.
If I have to travel to a place, if I have to learn a skill, if I have to visit a professional, then these are instant barriers to be able to choose these practices. And so, again, going back to behavior change, boiling the ocean with behavior change is a very difficult thing to do. Picking up a tiny, new, subtle habit and anchoring it to something that you already have works. The research is like completely clear in that respect. So what I think digital enables is accessibility. Digital allows us to integrate some of these practices into different parts of our day. If you seek to have a mindful practice and you set yourself a target of meditating for 20 or 30 minutes a day, well, guess what? It's going to be really hard and maybe you'll last a week. But if you think about some of the practices that you already have, brushing your teeth or something, some ritual that you have during the day, and you just bolt on a minute, then you've already shifted in the right sort of direction. So I think we set ourselves like too high bars in behavior change, and we try and make them new occasions. And we forget that actually we already have lots of rituals. We may even have a lot of the practices that already help. And what digital can do is find itself in our day in a much easier way. We all have access to wonderful and almost limitless content. And so all we need to do is just nudge that content into the right parts of our day, not go too extreme by picking up, it's not about entering a marathon, as I said, but if you take a meeting walking outside, it's a step in the right direction, pardon the pun. So there's an accessibility that I think digital provides. To a certain extent, digital can also, with sensor technology, it can give us access to information that helps us learn ourselves a little bit more. There's a bit of a danger there, I would say, though, because we don't want to assume that every person out there wants to turn their life into a science project. And often all the data does is remind us of some of the bad things that we do. So it becomes, again, a sort of a limitation keeper rather than an opportunity to create change. So there are right measurements that matter that digital can enable. But I think content and access to a community is probably the most powerful one. And that's, for us, is why Mirror became a really important acquisition for anyone that has seen that. Because it puts a community wherever you need that community to be, and that community will support you in those difficult behaviors, knowing it's difficult to start those behaviors.
Yeah, I mean, some really good points, and I totally agree in terms of changing your behavior to be more wellness focused. You got to start off in small bits, and you got to like it. And it's got to be accessible, and they're the key things. I totally agree. So would anyone else like to comment on that in terms of behavior change, digital? Anyone else like to jump in?
So I think there's something about, I agree with the behavior change is really hard, and accessibility and accountability or community are two places to really help drive that movement. The other thing I think it opens up is innovation. Right, it gives an opportunity for innovation and to enable the ease of that change, either through using digital, and obviously the revolution in biology and digital in the last 10 to 15 years has allowed us to learn things that we never knew before, and allowed us to unlock opportunity within that. So digital in that way. But I think there's also the ability to understand behavior in a way that we hadn't before either, because we can pull together larger data sets. And the example I always love to give is understanding actual consumer behavior, like hand washing. And it's a great example. It's actually a pre-COVID example of, if any of you have kids or have ever been around a kid and asked them to wash their hands after they go to the toilet, no child washes their hands for 30 seconds. Like if we sat here and counted down 30 seconds between all of us, it would be a really long, uncomfortable silence. It's a long time. no kid washes their hands that long, yet the WHO recommendation is obviously for 30 seconds of hand washing, rubbing your fingers, and we've all seen the content and the education in that space. But by developing technology that allows for that germ kill in a shorter time frame, that's more real life use, and I'm sure there's great examples in oral care and in other self-care areas as well. But by developing those technologies, you can then work within the paradigm of the behavior that you already have, which then innovation doesn't cause you to have to change the behavior quite as much as you would have otherwise. And that came to mind, Tom, while you were speaking about that, of how digital has helped us actually unlock being able to work within that behavior, so you don't have to change it quite as much. Because we've worked for decades on education programs to get children to wash their hands for longer than 10 seconds, and they don't do it. So we have to change the innovation in order to help enable that. So it's a great example of how digital, almost flipped on its head, helps to do that. But I totally agree with the community aspect of it, as that really supports behavior change in other areas.
And building on, if I may, on this great discussion about behaviors, I think there is an interesting dynamic which is worth to call out, because clearly what we have been observing recently is how the majority of people are taking their health into greater consideration, so the willingness to take their health in their own hands. But then two things. From one side, as you said about washing hands, etc., we also noticed that some behaviors are totally disconnected. I guess you have read the report about the poor oral hygiene over the COVID time, which has led also to higher risk, not only of hospitalization, but also bigger risk. So that's one element. So there is a disconnection. But there is another important element, because when we have conducted a study at the end of last year, and the interesting outcome was that only 2 out of 10 European people, they really feel confident about managing their own health. So there is a huge space, I believe, for different players to help improving the situation and finding a way to acknowledge that. And clearly digital plays a key role, especially based on what you say, Tom, in terms of accessibility, in terms of providing something which is easy to be used and to be leveraged.
I can just chip in as well. I think it makes it even more important when something isn't top of mind. When something is top of mind, it's easier to make that change. But oftentimes these topics aren't top of mind for the people that need to change their behavior. I think digital's got a key role in that, and making things super simple. And we can start with the areas that are top of mind. You take something like, one of my favorite topics is body pain. If someone is suffering, they're motivated, right? It's top of mind. And even then, most people don't know what to do, and they're searching for different things, and they have got different companies selling them pills, exercise, a slightly judgmental app, topicals, naturals, CBD. And actually it's super confusing, even for the motivated, educated, lots of time to invest person. And so I think digital has a key role there in simplifying things, stitching together solutions. I hate using the word ecosystems, but it's that really, to help people understand these are the options available to you. And I think that is a good place to start before we waste all of our time and money on areas that are so below the radar in people's minds that the nudge is not going to work.
Yeah, thanks, David. Thanks, everyone. So I just want to take a bit of a different tack now, because someone did mention the idea of partnerships, and there's just been a question in the chat about this. So we all say in partnerships are important, collaborations, whatever you want to call it, alliances in driving health improvements. But has COVID changed that in terms of partnerships and alliances for you guys on this chat in terms of driving health improvements? Tom, maybe we'll go to you.
Sure, thank you. I mentioned a little earlier. So we made an acquisition during the year last year And for that, the intent of that was, we believe that the things that we're really good at is, from a sensory experience, we nudge people in the right direction. The products that we put on and around our bodies encourage us at least to be active, and we know that being active has a massive impact across all dimensions of well-being. And our normal business model is that we are active through our retail footprint around the world. Our stores exist in communities. They each serve those communities uniquely, and they integrate with those communities via the local studios and run clubs and fitness professionals and health professionals in such a way that we keep that community really top of mind to health being an important step in the right direction. So the partnerships for us have always been very local, quite grassroots, until we realized that retail stores cannot be open for a period of time, until we realized that people have got so busy that that occasion of going to a local studio is harder and harder to do. If you're an extremely busy professional mom of 3 and still trying to run in like that complex life, anything that we can do to create accessibility to that community in a different way is really important. Lululemon cannot switch on being a digital company, but we can partner with digital companies who share the same values and beliefs about the importance of accessibility to health practices, to well-being practices. And so the partnership with Mirror is one great example, but that for us is really just the beginning. For us, it is about partnerships, absolutely about partnerships, because there's no one company that's going to change people's attitude towards or accessibility to living a healthy life. I think it's actually not a zero-sum game either. So I think there's still a great deal of consortium opportunities where the companies like us here on the screen, if we were to partner together and say, well, what would we do? What would we do to change the availability of healthy practices? And I love, David, what you said about we've basically got a lot of dry powder. There's a lot of motivation, but there's a lack of an ability, and there's a lack of the right prompts in a timely fashion. And so we all have to play our part. There's no silver bullet. There's no one partner or one acquisition that will make all of the difference. So I think there's different companies like us. We'll build partnerships associated with positive healthy practices, and we need partnerships with other players, or at least just in parallel, to also start to say the same thing. Being healthy is not as scary and serious as we might have held it. It's like, once that becomes the mantra, I think we'll bring people with us.
Yeah, and I think, thank you for that. And I think in the question it says mergers and acquisitions or partnerships. So I see those as totally different things. I don't see a merger and acquisition always as a partnership. And I'm sure Sam and Filippo and David all have something to say about that. But Sam, do you want to make a comment on partnerships and
Sure.
Yeah,
I
the
think
importance of them?
I think your comment is interesting about acquisitions being a partnership or not. And if you think about I can certainly use examples from our portfolio. If some of the acquisitions we've made in the last couple of years of really strong founder-based companies that we do bring in as part of a family and part of a partnership, and those founders remain absolutely part of the journey of those brands. Things like Welly and Ollie or Smarty Pants, those founders are become part of our DNA, and they don't get subsumed under the waves of Unilever, never to be seen again. So I do think they are a partnership with the emerging areas that we're looking at. Having said that, we also have lots of partnerships. One that I'd love to highlight is one with a company called Longevity, which is an AI company, and we're looking at really driving health and well-being in a couple of different areas, understanding this multi-omic big data and personalization on product choices and treatments for things like acne. Not just for the solving of acne as a medical condition, which is super important, but also the health and well-being and confidence and all of the sort of interpersonal bits that brings to people who suffer from acne, for example. So we partner with a lot of folks across, and we've also been very active in some of these emerging health spaces in acquisitions. The Vegetarian Butcher is another great example, and our food and refreshment of really getting into plant-based protein, or a partnership with a company like Algenuity, and what is microalgae going to do for us in the area of protein, alternate protein sources and health. And so I think there's a bunch of different ways you can partner with companies. Either, you have aligned future looking strategies. I think Tom's example of Mirror and Lululemon is great in that area. I think there's, places where your business complements, or a new business area you want to get into, or technology and innovation that you want to access for the brand set or company set you already have. And I think probably across all of us, we play in all of those areas to really, because at the end of the day, what we want to create is differential science and technology that drives this well-being, whether you're doing it through a personal care product or a food, whether you're doing it through accessing healthy exercise through a consumer health product, or through a regulated drug. We're all trying to get to the same endpoint, which is allowing people to take their health into their own hands. And none of us have, although we all have wonderfully capable and smart departments within our own walls, it's together we're going to do it much, much better. And that's why you see all this activity and partnerships across the piece.
Okay, we probably should move on from partnerships, etc. But I guess, Filippo, you could comment on mergers and acquisitions with GSK and recent. And is that a partnership? And I guess in this other question that's come up about the benefits of corporate wellness initiatives, and have corporate partnerships changed a lot with the advent of COVID?
Look, I could comment on M&A acquisition, but I think my colleagues here, they come with similar experience, because when I look at the companies they represent, they could tell a lot as well. I think probably on the partnership dimension, as I see also the question from the audience, I would like to maybe provide a bit of additional perspective, looking at the multidimensional element that was called out before, because first of all, I think in the current environment, there is a huge opportunity to leverage partnership by creating new product and service experiences that are able to blend with the technologies that consumers are using, and also with other brands. So which means that opportunities in partnership are pretty broad when you look at the way consumers currently behave in their daily life. I would say there is a second dimension, which is the one that, of course, we call out pretty often, which is about how to have supportive policy and regulation that enables the right self-care practices. And I think during the COVID time, this was absolutely critical and evident, and I think it's a big element of reflection as well. The third one, back to my introduction when I started to talk about HCPs, when I talk about healthcare professionals, I think again, when especially you look at Europe, about 58% of European citizens have close access to a pharmacy nearby where they live. So to me, partnership is also about understanding how to leverage the so-called ecosystem in these ways, and how to leverage the opportunity and the accessibility of reliable sources. So three dimensions that I wanted to call out again within the partnership world, which is absolutely relevant to me.
Okay, thanks, Filippo. So David, let's go to you now. And one of the questions that we had already pre-planned about, is health the new sustainability? And in light of the pandemic, how have consumer demands around health and well-being changed, which we've touched on a little bit, but how should commercial leaders respond to these demands? Have you got any thoughts on that?
It's a really interesting question. I think, is health the new sustainability? Maybe. I think for me, in the sense that, better data influences stakeholders and generations and attitudes. So, there's a lot of similarities of topic. I think this, the data and technology hit the sustainability industry for want of a better word, a couple of years ago. I think they're different in that one's outward looking and one is kind of mostly inward looking for most people when it comes to these different topics. And what I think is interesting about health and sustainability is that they both share that attribute of invest today for future benefits. And this is part of the problem with behavior change for sustainable practices or healthy living, you know, the maintenance of good health and things like that. I think, with COVID, we've seen a move to more trusted brands, to science, to evidence, and an increased demand for transparency. And I really hope that all of those are here to stay. I think they are. One thing that I think that sustainability and health do share is the role of technology in accelerating the topic. Better data, investment in new technologies, that's driven huge leaps in sustainability from when I was first working in sustainability many years ago. And the same has happened in health in general. And I think that we're seeing it, and there's a lot more to come in consumer health. Take something like the biorevolution, super exciting topic, advances in biology coupled with advances in computing, that's potentially the source of the next big innovation. I think that's why we're investing more as a company in that. Back to the partnership topic, and investing in companies that are on the cutting edge of science and digital, because ultimately with all of these topics, health, sustainability, whatever big societal challenge, good data, creative minds, and then starting to partner to speed things up is the right way to approach it. And that's what we're doing. And I think when it comes to partnerships here, and I think this is not unique to Bayer, but from an innovation point of view, from licensing, drug developments, minority investments, M&A, it's all kind of on the table. The point here is about how can we accelerate our progress? How can we be very mindful that even if you're a large, successful company, you don't know everything, particularly with these new areas. And it sounds super obvious, but sometimes there can be a bit of resistance to it. And that's why I think partnerships can help you to break through, and having that suite of partnership options helps you to make the connections, make some progress, sometimes on the side, sometimes as experiments, much faster, that pushes things along. And that's where I saw the big successes in the sustainability topic 5-10 years ago, were unexpected partnerships. And that's what I hope we'll see more of in consumer health too.
Yeah, no, I agree. And innovation and creativity in terms of partnerships, and not, all the usual suspects doing what they've been doing for a long time. Would anyone else like to comment on health as the new sustainability, and how should we respond to consumer demands around well-being? And have you seen a lot of those changes? Would anyone else like to jump in?
I think Judy, I agree with David. Call out many important changes, many relevant ones, and I totally agree with him. So I believe that to make health sustainable, we really need to acknowledge that these changes have taken place. But at the same time, as I said before, there is a clear need from consumer to be supported in also better managing their health. So I call out the outcome of the research before. But again, building on what the colleagues say, that there was a nice example from David on body pain, and just sharing with you a very simple example related to my home country, which, as you know, it's Italy, as you can easily understand from my beautiful accent. So what happened is that in Italy, neck pain, for instance, is the number 2 body pain area after back pain. Nevertheless, there was in the last few months an incredible amount of searches about how to manage neck pain, and this is because working from home has increased the prominence of the problem for consumers. Right now, interesting enough, not all the consumers are treating the problem, are managing it in the right way, but most importantly, about half of them, they are treating the condition in a way which is not necessarily appropriate, because they're not really tackling what is the source of the problem and how to find the most appropriate solution, etc. Which again, it is a small example, but tells a lot about how needs have been evolving over time, and how a better literacy, a better healthcare literacy for consumer would help to manage these small or big diseases.
Okay, thank you. Well, actually, it's time to wrap up. I can't believe it. We didn't cover everything we were going to cover, but I think it was a really interesting discussion. And I think the panel should be congratulated because not one person mentioned build back better, which I'm really glad about, because that's all you hear on every Zoom call and every session. So thank you, everyone. And I'm going to hand back to Angela now, who's going to do a wrap up.
Thank you so much, Judy. And thank you to our panel. I just feel so privileged to have sat and listened to all of that. And I have to agree that hour absolutely flew. I don't know where it's gone. I could have listened to you for another hour. Look, thank you, of course, for watching and for your questions. Please do stay with us. We've got a whole host of sessions to follow, all running along this theme. I believe next we have a very interesting and important roundtable discussion looking at the concept of ethical claims, in particular what we can and cannot claim about wellness products. So do join us for that. But in the meantime, I will say a very sincere thank you to Judy and our panel, and goodbye.